Can I start with the introduction?
Yes, please.
Okay, so hello everyone, welcome. I would like to give a quick introduction. So Professor Claudia C. Cotca, DDS, MPH, is an internationally recognized lecturer, USA expert with ADA, SCDP, AAMI, ANSI, ISO, IEC, ITU, AFDO, healthcare analyst, dentist, and toxicologist, founder of various ventures in private and public health with expertise in innovation and clinical protocols, medical devices, global laser technology, clinical applications, and oral systemic axes, global healthcare sector intelligence, healthcare policy, and expert witness before USA Congress and White House. She is appointed at rank of professor at Liberty University School of Health Sciences and International Research Collaborator with Dental Research Center using conventional and alternative technologies, Victor Babiš University of Medicine and Pharmacy, Timisoara, Romania. Thank you.
Thank you so much, Krista. Very appreciative, of course, of the leadership that you have shown in the global leadership, dentistry, and sciences as a global ambassador for GLDS. Congratulations to you. And of course, the slate of 70 plus ambassadors currently GLDS has a presence in across the globe is really due to your leadership, execution, as well as formidable commitment. So with that, I'd like to welcome everyone, welcome ambassadors, welcome members, and of course, by extension, healthcare leaders and healthcare experts at large in interdisciplinary medicine, dentistry, and the healthcare sector in subject matter experts. Today's presentation will have the same format as previous. We will going to have a very, I would say, basic presentation of the components of the healthcare sector, subsectors, participants, and we're going to first today focus on the academic subsector within that scope. And the first slate of these series of subsector presentations are, of course, for more fundamental concepts information. I'd like to just acknowledge that I'm speaking to you from Washington Institute for Dentistry and Laser Surgery here in Washington, D.C. Metro. With that, I'd like to, of course, announce that we will be going through the slated 2022 Symposium series, which will incorporate the rest of the subsector variables of the 360 healthcare component, essentially all that comprises the metrics of what constitutes healthcare commodity sector. Some disclosures include that the concepts as well as information has been generated and conceptualized here on the premises as a DC as a dentist, C3 think tank, of course, 360 healthcare, GLDS, photography, clinical recommendation treatment. Every component of logic was also conceptualized here, of course, and I am affiliated with various different industry and institute collaborations, and of course, distribution is by permission. That said, the objectives for today is to really focus on the academia as a subsector, and we're going to touch upon again mere core elements and fundamentals in terms of the function of academia and the large extension of healthcare. The healthcare sector. We're going to identify also the participants within the academia as a subsector, as well as its requirements. And of course, we're going to look for past, present, and future extensions on that. 360 healthcare model incorporates all the variables that constitutes 360 healthcare sector commodity space, of course, for transaction purposes at every level. And that, of course, involves, as we've discussed formidably in the last, I would say, sessions that we've had the privilege of sharing already some of these subsectors, but they include the private, of course, and public health experts, and that's really the leaders. And subject matter leaders ought to lead their profession by virtue of autonomous designation. Of course, the other is academia, and which is what we're going to be discussing today. Research and development, of course, is a component within that deserves its own recognition. The industry, the regulatory aspects, legislation, government, jurisdiction, if you will, the business sector, the consumers, and of course the platforms that constitute that aspect, as well as the media, and of course the legal component. That said, within the larger extension of 360 healthcare we discussed earlier, the clinical experts, private health, public health, by extension, they are interrelated directly and indirectly. They are really the leaders. It is accentuated and logically verified and supported that these are the leaders of the healthcare commodity space, and as such they should be, because there's a Hippocratic Oath component within that type of requirement, that makes the case for exceptionalized and customized treatment of the healthcare commodity space. That said, healthcare commodity space is arguably and should be argued, and it is arguably as a unique commodity space and should be treated accordingly. The academic component is going to be our topic today, but of course I'd like to just mention from an R&D perspective, industry, medical devices, just a few examples. The regulatory, both in geo-positions, as for instance USA are the ANSI standards, but of course there's a larger extension within your own jurisdiction. And so as I peruse these details, please bear in mind and look from a perspective of your geo-position, not only just of interest and contribution, but also, of course, keeping an eye out and keeping sensitive or being sensitive to the information given, and of course with rendering subsequent, depending on interest, in terms of the collaboration across geo-position. But from a component of, for instance, regulatory aspect out of Geneva, Switzerland, there is a compilation of global delegations, respective geo-positions at the ISO level, IEC, ITU, and those are just a few regulatory bodies. Also, there's also a patent office as well. From a legislation perspective, the government jurisdiction has the, of course, rendition of influence and designation. But of course, remember, it is by geo-position differentiation. So the United States model will be different than another model in another geo-position, and they're going to have modifications of that. The business and corporate component, particularly the venture capital, for instance, is just another example in terms of pressure points. Consumers' information data, that's going to be, of course, also a very heightened and upfront and personal requirement in the next years, of course. Because of digitization, there's a legal aspect, of course, in the media. And with that, I'd like to jump in very specifically to the point of what we are essentially discussing today. And I want you to just remember and remind yourself to look from two different perspectives. On the top here, we're going to discuss, of course, the academia from the private health practice and the public health practice, but I'd like you to see it from an individualized perspective, meaning you as the expert are essentially the point of reference, if you will, within the conduit of academia. And of course, the one here on the more larger extension is essentially academia from the 360 healthcare compilation, if you will. And we're going to be going through the metrics of each. So starting with essentially the perspective of a healthcare expert, during the preparation of academic preparation, of course, the distinction as opposed to post preparation, post-education, meaning graduate, there has to be a recognition of interaction between those two. And so it merits, of course, that the comprised variables that constitutes the journey, if you will, during the academic preparation, of course, includes the curriculum, that involves the quality differentiation. There's a distribution component and capacity for impact that, of course, is accentuated by the other aspect and function of academia, which is basically the education. So they basically generate curriculum within the extension of their geo-position interactions with other bodies or variables of influence at the jurisdictional level. And for instance, Romania is very different established as opposed to, let's say, United States model on that. But within the academic premise, the education component, of course, is the actual execution or rendering of the information to the student And that, of course, it's a formidable recognition as a standard, but also there is a high-level value proposition that is available within academic setting, irrespective of geo position. So what I mean by that is there is there is an expectancy of behavior or understanding and performance in terms of information received, as well as remuneration and feedback and performance evaluation. But on the other hand, within the educational platform, what is very formidably available, unlike in other platforms or variables within the 360 healthcare commodity space, is this high value proposition of the availability of knowledge. And so that, of course, is influenced by a variety of different components within the university platform. The larger university, the larger the funding of the university, the more diversified the components of contribution to the university is going to have different opportunities for that type of high value or high level value proposition that students will be able to engage in, or students may not know that is there, but actually it is. And one prime example, for instance, when I was at the University of Michigan, of course, I took advantage of the fact that there are numerous different schools, from the school of, at the time I was in the School of Public Health, but there was the school, the law school, the business school, and then the School of Medicine. And of course, public health at the time program was under the auspices of the medical school for my program, but also at the same time, it had collaborations and interrelationships, if you will, with the law school, with the business school. And so taking courses and being taking initiative to interact in that particular extension with the various different opportunities within the school that are typically available to the students within the school, but there's more legroom of discovery, if you will, for other students outside of that particular school. And so by virtue of what is considered, I would say, recognizably important and valuable, is to recognize that there is an expected average homogeneous expectancy of information that is derived, that is to be tested and expected to be regurgitated and perform at a certain level. But there's also extensions outside of that. And this is what is formidable about academia. And understanding those nuances, of course, is important to note, because the opportunity is unique, it's time sensitive, and while students are on the premise of universities, they have access not just, for instance, to collaboration and contribution and accessibility to discovery, but also at the same time they have access to databases that otherwise would not be accessible, just because of the extension and collaboration security that academic sectors, or academic entities have with other entities, whether be it governmental or non-governmental or organizational. So we're going to, of course, at a subsequent presentation, we're going to go into much more detail, but I just want to touch essentially one of the perspectives, at least when we're talking about the components of what constitutes academia, or in general academic subsector. Another factor is the research and development, and of course it's going to vary. The research development component, of course, is going to be different. The research side is going to be different. The development side is going to be different. What I mean by that, in terms of there's research, discovery, processes, etc., but innovations are not always formidable in terms of comparison by value within other, with a respective competitive innovation. So there's discoveries that essentially are more like trophy type discoveries, and the discoveries and innovation that actually merit penetration or merit market exposure and market penetration. And so that, of course, is driven by funding, but primarily it ought to be driven by the value proposition, intrinsic proposition of actually what that discovery would do within the context of the expert subject matter. And that is, of course, best recognized and developed by the expert, not by, for instance, another variable within the 360 healthcare component, such as, for instance, venture capital pressure, or open market pressure points, as opposed to closed market pressure points. Another aspect of academic is, of course, the distribution and commitment of publications. And that is an incredible, I would say, arm that can be taken advantage of during the premise of, like, of course, as being a student or being affiliated as either undergraduate or post or graduate student or even postgraduate, when on the premises of academic entities, jurisdictions. And the contribution aspect, of course, needs to be, I would say, initiated oftentimes on the student side, and it is exceptionally available. And so a lot of initiation should be encouraged for students and also later as graduates, and I'll mention how in a moment. Continuing education is the other component that postgraduates, for instance, and alumni can take advantage of, and of course in collaboration with universities can of course promote, co-promote and collaborate in essence in terms of positioning and taking advantage again of unique opportunities to promote and to as well as take advantage of the variables that academic entities have uniquely available at their fingertips, whereas other entities, even in the private sector, they do not. Another aspect within academic the academic space is the patient care. And of course, remember, there is a component of patient care that is done by students on live patients, as well as patient care that is done by postgraduate students, clinicians, of course, as well as faculty. And this extension depends, irrespective of geoposition, irrespective of affluence, irrespective of funding capabilities. This particular opportunity, I remember I was just an undergraduate in 1993 at University of Michigan. I hadn't even applied to dental school yet. That was only to become 3 years later because I was still at the university in chemistry and cell molecular biology. And yet I took the initiative to essentially approach hospital dentistry, which is within the auspices of University of Michigan Hospital, so that I could volunteer once a week and essentially wet, my feet, if you will, and fingers and neurons into information that is expanded. And so over the years of doing that and being involved in that type of volunteer exposure, it really gave me formidable introductions. It gave me incredible exposures. And that, of course, has subsequent additive and synergistic availability for opportunities for further collaboration. And every single, there are numerous details that I could list on that. That said, the state, of course, also subsidize hospital entities within the aspect of the various different academic structure. Sometimes, for instance, in the United States, an open market can be that are private-driven funding entities as opposed to government-sanctioned, etc. Those differentiating characteristics will definitely have an impact in terms of the plausibility of the information, the quality, the quantity of the information, as well as the performance grade. In the United States, curriculum, of course, and as well as schools are graded by tiers, tier 1, tier 2, tier 3, and other jurisdictions, I'm sure there is a similar type of grade. And the point is that understanding where your academic entity lies and being able to identify, for instance, what it has readily available. And if it's not obvious, taking the initiative to find those nuances, and these days is very easily, obviously, it's visible online, but also, of course, because you have access to that territory, it is absolutely important, crucial that you take advantage of that. Not only that within the general mainstream vector of interaction, and of course this requires outside or additional efforts, but it's worthwhile efforts that will inevitably help simultaneously as you peruse and journey the academic curriculum process. However, the availability for the individual to actually hone and create hone leadership or hone initiatives and position oneself to essentially creative propositions with various different leaders at the grassroots level, at the of course high level C-level suite, at the deanship level, really merit a great deal of attention. And this is where I think the opportunity during the actual journey as a student is oftentimes missed, but of course it's not to be also ignored post-graduation. And so with that, now from an academic subsector perspective within the healthcare sector, variants, if you will, or element, if you will, we of course have the geoposition component that is going to have a premise of impact in terms of how that academic entity is established and how it operates. Is it government funding? Is it a combination of government and private? Is it international funding? You know, there's a variance, of course, in that regard. That said, with respect to, for instance, the autonomy of the profession within the academic, it becomes a little bit more easier to pinpoint and to understand how that takes place, because academicians are themselves subject matter experts, right? Majority of which, largely. Very few, for instance, business CEOs that have no subject matter training will have essentially a position of leadership in those particular nuances. But that said, the accreditation and the autonomy that is essentially identified by the jurisdiction of how that setup is in that particular geoposition, and that's influenced, of course, by government. It's influenced by the autonomy of the subject matter. It's influenced by a lot of regulatory, the industry, the component of the economy, open or closed markets, the industry impact, the availability for industry to compete or not compete, and that will take a great deal of I would say impact into the fluidity of the academic, not of the academic center, not only in its own locale and community, but also by extension internationally or across borders. Looking at the standard care model in geoposition will have a great deal of influence on that in terms of private practice, public practice, but also versus managed care. The real-time contribution is essential in terms of timing. I'm going to repeat this. The real-time contribution is absolutely essential in terms of timing. That means that during academic preparation, there is an opportunity for, as I said, for the penetration, distribution, and collaboration that's very unique. Take advantage of it. And of course, post-graduation is going to be, again, available, but rarely it is taken or I would say exercised. The funding component merits attention and recognition, and it, of course, will be varied. In the subsequent presentation on the academics sector, we'll be going into a lot more details on this and the opportunities that are there by geoposition as well as global extension in terms of collaboration. So that said, in terms of the objectives for today, essentially we were to identify the academic function, and I hope that that was clear, including the participants, including the requirements of academic temperament, if you will, or expectations. And of course, looking at past, present, and future implications, we're going to be looking for much more detailed presentation in terms of what are some of those vectors that can be that have been identified, have been utilized by other individuals, myself included, but also, you know, can be, of course, discovered, because, you know, there's always a new variant, if you will, as time passes. And with that, I'd like to say thank you so much for your attention. As we usually do, we do entertain questions. However, we will, of course, have an open podium for questions and remarks, but I will say that we of course look forward to following up with much more larger detail on this particular topic, and of course we also look forward to seeing you at our next global symposium on the schedule for the 2022 symposium slates. So with that, I like to just say goodbye from Washington, D.C. for the recorded portion. And of course, we're going to go now into remarks and questions.